Well, good morning. It's a pleasure to be here, and thank you to the committee for inviting me to talk about a topic that seems to be gaining a lot of attention, and hopefully there'll be a little bit of understanding after my talk and not so many questions, but there usually is a lot of questions when you generate research. I'm going to show several trials that I'll try to go through fairly quickly, and then I'm going to end with a recent study that we did looking at the interaction of stress and respiratory vaccination. I want to start off, though, by just talking about philosophically about why are cattle high risk. We know why they're high risk. The way our beef production system is structured, we wean calves many times directly from the cow to the sale barn. There's various stressors that we all know about, and we know that stress causes immunosuppression in animals. It's plausible that during the marketing process, cattle are likely exposed to viruses before we ever get them. And so there's several things that go into making an animal high risk. And we know these things, we identify these things through the marketing channel in an attempt to classify groups or truckloads of cattle into various disease risk groups. The problem is, whether it's a low risk, medium risk, high risk group of animals, there's large variability in a truckload of various risk types, right? And so the heterogeneous nature of the high-risk truckload is very challenging as far as research, and it's challenging as far as what are the appropriate products or what are the appropriate vaccine strategies we need to provide these cattle upon arrival. Because right now, feedlot processing procedures, they vary from one feedlot to another or one consulting veterinarian to another, but they're pretty well, those are pretty well homogeneous. We don't adjust those per se based on the risk group of the cattle, with the exception of maybe metaphylaxis, of course. So I want to show some current industry practices surrounding vaccination of high-risk calves. And this data is from the recent Feedlot 2011 report. And essentially all cattle arriving at large feedlots in our country, in the U.S., receive some sort of respiratory vaccine. And then they've broken it down by antigen. And as you might expect, BVD virus and IBR virus are almost all cattle receive those two particular vaccine agents on arrival. And then you look at the others, and this is broken down by the percentage of feedlots as well as the percentage of cattle. The others decrease somewhat because of our thoughts of perhaps those may be less important in the disease. In that survey, they also looked at Pasteurella, which that was so Mannheimia hemolytica and Pasteurella multocida would be lumped into that. And a lot of feedlots use a Bactrin, but a lot lower number of cattle. And then over the last 10, 15 years, we've seen quite a few feedlots or quite a few consulting veterinarians take out Clostridials from their processing regimen, probably for good reason. However, respiratory vaccine used for treatment of BRD, and I have treatment in quotations because since when has a vaccine been treatment? I don't know. But I was pretty surprised at these numbers, how many feedlots and how many of the cattle in the U.S. receive a respiratory vaccine as ancillary therapy, I guess, if you will. I don't know, guys. I don't know about this. And Hopefully the data I show, if you do suggest this, if you're a practitioner, perhaps the data I show today may change your mind. If not, give me a call and we can argue about it. And it's interesting, I just pulled these directly up, a couple label statements from vaccines, and one is revaccinate annually prior to times of stress or exposure for good reason, and protect animals from exposure for at least 14 days after vaccination. Is this happening with the high-risk calf? Not at all, right? So, stress. We hear that term talked about in general a lot. It's very complex. I'll try to just briefly define what physiological stress is. And cattle recognize or perceive a stressor, and that is recognized by the brain, and that acts on the hypothalamus to produce CRH and BP, corticotropin-releasing hormone and vasopressin, which then can act on the pituitary to stimulate adrenocorticotropin hormone, which then acts on the adrenals to produce either catecholamines, which would be epinephrine, norepinephrine, very rapid, immediate, millisecond response, or cortisol is also produced by the adrenals and is very rapid as well, maybe not as fast as catecholamines, but I'm going to focus on cortisol today, and most of my, at least in the study I'm going to show. And we know that glucocorticoids or cortisol impacts various tissues and cells in the body, and namely immune cells, right? And particularly neutrophils. And so one thing cortisol production does is downregulates L-selectin expression on neutrophils. If you remember your immunology class, L-selectin is that first connection to start to make that neutrophil slow down in the blood flow and translocate into tissue. And so if we're downregulating L-selectin with cortisol, that's why we see a significant increase in the neutrophil concentration in the blood, because those neutrophils can't leave the blood if they're impacted by stress or by cortisol. It's also incorrect, in my opinion, to just say stress is stress. There's different types of stress. Acute stress, there's evidence primarily in the human and the murine model, but there's evidence that acute stress may actually be immunostimulatory. And by acute stress, I mean moderate intensity and particularly short duration of stress, less than 24 hours. However, when you talk about a chronic stress event, this is a combination of a lot of stressors that occur over a long period of time, days to weeks. This has pretty clearly been shown to be immunosuppressive in the human and the murine model, and also in cattle. Acute stress. I think of acute stress as, in relation to vaccination practices, being, okay, we're a cow-calf producer. It's branding time. We're going to separate our cows and our calves, vaccinate the calves, and within hours they're back out on the pasture with their pairs, happy, everything's good, right? Chronic stress is probably what is experienced by high-risk cattle. As they transition through the marketing process, that can take several days, right? And they encounter various stressors during that time. And it's really important, in my opinion, as a vaccinologist, to separate vaccine efficacy from vaccine efficiency. Vaccine efficacy could be termed as a reduction in the severity of disease after challenge, but this is typically shown, or at least for USDA approval of biologicals, this is shown in an ideal model, right? We take seronegative calves that hopefully aren't stressed, stressed, we vaccinate them and then challenge them sometime later with an analogous virus. Vaccine efficiency relates to how cost effective is that vaccine under real field conditions, and that are we reducing disease or increasing performance in the field, in the feedlot or the stalker scenario or wherever, by giving this vaccine. Is it providing an economic advantage? And there's an equation you could, it's really theoretical, it's almost probably impossible to measure, to use this equation, but if vaccine cost, and vaccine cost is the price per dose, right? What's another vaccine cost? Do what?
Labor.
Liver?
Labor.
Oh, labor. Yes, labor. Decreased intake. I think you're going to see a lot of research that show if the vaccine's good, it's inflammatory, right? And the animal is going to produce an acute phase response to that vaccine, and there's a metabolic cost to that. So in recent research we've done, we've seen pretty consistent transient decreases in performance, and various vaccines have stimulated an acute phase response versus control. So that's another component of vaccine cost. But if vaccine cost is less than our disease incidence, multiplied by disease cost, multiplied by how well the vaccine works, then we have efficiency. So going back to the typical efficacy model, this would be a very typical model that you look at to evaluate vaccine efficacy. You vaccinate the calves on day 0. You may challenge with an analogous virus 28 days later, which is plenty of time for the immune system to respond to that vaccine. And then you compare clinical and pathological outcomes versus a control group that does not receive a vaccine, right? This is what I would envision as a controlled high-risk vaccine efficacy model. You stress the cattle about 4 days prior to vaccination. They're taken to the sale barn, they're pulled off the cow, etc. You challenge with a virus, because oftentimes cattle, high-risk cattle, are exposed to virus at the sale barn, right? And then you get them a few days later after they're sorted out and come from the auction barn and arrive at the feedlot, and you administer BVD, say BVD vaccine on day 0. Then you do that same comparison. In such a model, I don't know if you would get to the 4th box, because they may all be dead if the BVD is fairly virulent, right? And this is what's really happening, I think, in our industry, and it would be really neat if someone would do such a study. But we have evaluated in a field setting several studies looking at the timing of respiratory vaccine, either on day 0 or day 14 in high-risk cattle, with the thought that, we receive these cattle, they're stressed, let's give them 2 weeks to acclimate, to get over that stress, to let that cortisol concentration come down before we give them a vaccine. They'll respond better, perhaps. We'll get a better vaccine response, etc. And in at least 3 studies, we were not able to show differences in health. In the very first study we did see an improved performance for the delayed, perhaps going back to that inflammatory response when a bunch of other stressors were piled on at that time. It may have helped performance a little, but the subsequent 2 studies, no difference in health or performance, whether we gave that vaccine on day 0 or day 14. We never did see a blunted antibody response in any of those field studies, and that leads us to the study that I'll end up on. Real quickly, here's a 4th study that this was published in Bovine Practitioner recently. And we didn't do any serology in this study. It's just a health and performance study. But we used 370 high-risk calves. They received Bovishield Gold on day 0, day 14, or we finally wised up and said, let's put a negative control in the model at least through the end of the receiving period, right? Because to test a product, you've got to have a negative control, right? We don't do that in vaccine studies very often, but we did that here, and we compared contrasts of vaccinated versus control and then the timing. And we saw some performance differences. I'm having a hard time explaining these biologically, but we did see an increase in performance for the delayed procedure from day 14 to 28. And then overall, the non-vaccinated groups, NMLV, numerically gain greater. That's not significant. That would be this contrast here, but you can see the means here. Here's the health results from that study, and absolutely no difference in overall BRD morbidity, whether they got a vaccine or not. These are in high-risk cattle. However, when you look at the relapse rate, it's fairly clear to me that in this particular population of cattle, if we didn't give those cattle a vaccine, the relapse rate was much greater. That's approaching significance. The p-value is 0.08. But, if I'm a consulting veterinarian or a feedlot manager, if those numbers are real, that's very meaningful, right? But that 0.08 p-value brings up another concern with the small pen setting, in that if we have a small pen where we've got 10 animals in each pen, it only takes a difference of one animal to shift the change in morbidity by 10%, right? In a large pen scenario where we have much more sampling units to derive a mean, which is morbidity, and this is particularly concerning with binomial data where it's yes or no. We have a lot more room for error, if you will, for false positives, false negatives in the large pen setting. And here's kind of an example of pen size with the same means but various sizes or sampling units per pen, and you can see that as the pen size gets larger, variability decreases quite a bit, and between treatment variability is what drives the p-value, right? And so, long story short, I would be cautious about morbidity and mortality data from the small pen scenario. So some conclusions from these studies. Vaccine efficacy, yes. We never saw a blunted humoral response, at least, to the vaccine in any of those field studies, but efficiency, I think it remains unclear. And these studies are very inconsistent. And you ask yourself, why is that? Well, we use various vaccine brands across those 4 studies, but I don't think that has any play in the results, whether we used a BI product or a Zoetis product or a Merck product. I don't think the brands are impacting the inconsistency. I do think that we definitely could have type 2 errors because those studies I showed you are all small pen studies to where the means may be biologically relevant, but our p-values aren't suggesting significance. And definitely variable population dynamics, both within a truckload, even within pens that are on the same treatment, right? And that's where the small pen scenario, you should be cautious because even within the same treatment, we could have very different population dynamics and increase the variability. Stress reduces the vaccine response, right? Everybody's heard that in popular press over and over. We designed a study to evaluate this in collaboration with USDA and Texas Tech to try to create an acute and chronic stress model like I talked about earlier. we were pretty sure there's differences in acute and chronic stress. And then we measured lots of parameters. I'm only going to show the titer results today. But we received 32 seronegative to all 4 of the major respiratory viruses from an isolated, unvaccinated herd in New Mexico that is a 100-year-old ranch that has never used a respiratory vaccine. I'm glad I found it. We assigned those randomly to individual stanchions. This was a very intensive study early so that we could measure CBCs, L-selectin expression, neutrophil oxidative burst, lots of intense measures that I won't show today. So they had a jugular catheter in, and then we also had an indwelling rectal temperature device that we could continuously measure rectal temperature. And this treatment timeline shows our treatments of control, acute, and chronic stress. And for this study, we used dexamethasone and exogenous cortisol as our stress challenge, for our stress challenge model. There's limitations to that, I know, but it's a model, right? So the acute got the dex right before vaccination at hour 0 here. All cattle were vaccinated at hour 0, and you can see the chronic cattle got dex over several days, whereas the acute only got it once. And then we relocated those animals to West Texas A&M and bled them weekly to evaluate titers. We looked at antibody titers to the 4 major viruses. This was done at TVMDL in Amarillo. We also measured titers to, and so it's a modified live vaccine. I should mention we used Pyramid 5 plus Pre-Sponse SQ, which is one fraction of it is modified live, the other fraction is non-replicating. For the non-replicating component, we evaluated sera for MH host cell antibody concentration and leukotoxin antibody concentration at Oklahoma State in Dr. Comfer's lab. We also looked at acute phase protein response in our own lab and found that the control animals had, this is ceruloplasmin that we're looking at here, and the time that we measured this particular acute phase protein in the sera. The control animals had a greater ceruloplasmin response. And remember, that whole process is somewhat inflammatory, and we weren't surprised by that. Both stress treatments were blunted. Here is serum haptoglobin. I love haptoglobin because it's such a sharp response to, I used to say stress. I'm not so sure now. I think these acute phase proteins are produced in response to inflammation. Our model would suggest stress blunts the acute phase response, because if we're decreasing cytokine production, cytokines are what stimulate hepatocytes to produce these acute phase proteins, so therefore stress, in my mind, would actually decrease the acute phase protein response, and we saw that fairly clearly. So we also measured titers to the live portion of the vaccine, and here we're looking at the serum BVD virus antibody titer concentration. Keep in mind this is a log scale. BVD was increased especially for our chronically stressed groups. Same with IBR virus. We weren't able to separate acute and control out very well, but essentially I think we caused acute immunosuppression and chronic immunosuppression in these cattle. The non-replicating component was the opposite. We saw that the stress treatments had a blunted response to the non-replicating components in the vaccine. Here's serum MH host cell antibody. Here's the leukotoxin antibody. The stress treatments had a blunted response to these. And we know that glucocorticoid effects cause immunosuppression. that animal's immunosuppressed and you're giving a live replicating virus to that host, that virus is going to replicate out of check, if you will, and the total antigenic stimulus is going to be greater for the live replicating agents, whereas the opposite effect occurs if it's a killed or non-replicating. So quickly, in summary, almost all high-risk calves receive a respiratory vaccine. In my opinion, that efficiency is questionable in high-risk calves. Keep in mind the risk for type 2 error, where we're saying something is not different, but biologically it may really be. And then stress-induced immunosuppression likely results in enhanced antibody response to that vaccine, whereas the opposite effect is probably likely for killed or non-replicating antigens. So I've been saying it for a long time. We need a negative control vaccine study in the large pen setting. Don't think there's too many vaccine companies out there that want to sponsor that, but I would love to be involved in that if you have the means. And we may need to rethink the current dogma of vaccine response in stress cattle. Depends on the antigen type. If it's live, it's greater. If it's killed, it's blunted. Thank you.